Before start this video, please subscribe my channel and click on bell icon. Thanks.
Guntur, in a world where beauty standards and physical appearances hold significant value, plastic surgery has emerged as a beacon of hope for many individuals. India celebrates the National Day of Plastic and Reconstructive Surgery every year on 15th July, marking a decade of successful implementation. Now, this significant day has transcended borders and evolved into World Plastic Surgery Day, celebrated globally. The essence of plastic surgery lies in its ability to reconstruct and restore, offering a new lease on life to those in need. Sushruta's pioneering work, documented in the ancient text known as the Sushruta Samhita, introduced concepts such as Snubandhen Jevita, which focused on reconstructing the nose and ears. This fundamental understanding paved the way for modern-day reconstructive surgery, observed renowned plastic surgeon and director of research at Vacancies University of Health Sciences, Vacancies UHS, Dr. Sumita Shankar. She, however, said that India faces a unique set of challenges that necessitate the expertise of plastic, reconstructive, and aesthetic surgeons. Flame burns resulting from homicides or suicides, acid attacks causing chemical burns, electrical burns affecting individuals across all age groups, and injuries caused by bear bites, are some of the problems we encounter. Moreover, we carry the burden of chronic infections such as leprosy and elephantiasis filariasis, noted Dr. Sumita. A senior plastic surgeon Dr. Nishant Sadnala of Amaze Medespa has requested the Chief Minister Y.S. Jagan Mohan Reddy to expand plastic surgery services under Vacancies Arogyashree to specialized care centers to extend the services to the poor. In fact, small surgical centers would also survive while helping several hundreds of people get their pride back. Our compact setup incurs lesser costs compared to nursing homes and corporate hospitals, making quality care more accessible. While the existing Arogyashree packages for plastic surgery fall short of meeting the needs of corporate hospitals, the absence of specialized centers in the network hospital is a big disservice to the poor, said Dr. Nishant. Plastic, reconstructive, and aesthetic surgery has the power to rebuild lives, restore confidence, and ignite hope. We can serve more people with better awareness, observed Dr. Sumita. Plastic surgery gives another life. Plastic surgery has become a vital and essential department in rebuilding the hope of the victims of accidents. Absence of plastic surgeons in government hospitals is prompting the people to depend on private hospitals. Extension of Arogyashree to state-of-the-art P. Thanks for watching. Please like, share and subscribe my channel.